In diagnosing rabies, first open the dog's skull with either a saw, butcher's cleaver, bone forceps, or chisel. Use a sturdy table and work in an isolated room. Always wear protective gloves. Ply back the bone section. Prepare the brain for removal. Shell out the entire brain onto an ordinary picnic plate. Then take it to the laboratory for examination. Destroy the rest of the dog's head by incineration. Although Negri bodies, which determine the positive evidence of rabies, may be found in any portion of the brain containing nerve cells, they are generally prevalent in Ammon's horn or the hippocampus. Examine this section first. With small, sterile scissors, cut deeply through the cerebrum into the ventricle to expose Ammon's horn. Ammon's horn is the glistening white cylindrical body bulging from the ventricle floor. Remove 1 or 2 millimeters of a cross-section of Ammon's horn. Place it on a wooden tongue depressor. Apply a slide to the cut surface of the tissue. Make several impressions on the same slide. Stain the impressions immediately while they are moist. Cellar's stain is the one most successfully used. Withdraw the stain slide at once and wash it under tap water. After drying the slide and locating well-distributed large nerve cells in the thin areas under low power, examine individual cells with the oil immersion lens. The arrows indicate Negri bodies. These dark-staining basophilic granules within the Negri bodies are characteristic. Never report any specimen Negri negative until you have thoroughly examined sections of Ammon's horn, cerebral cortex, and cerebellum on each side of the brain. Use the mouse inoculation test on specimens which prove Negri negative or questionable upon direct examination. Anesthetize at least 3 mice by dropping them into a battery jar containing ether. Then inject intracerebrally into each mouse 3/100 cubic centimeters of a 10% brain suspension, using a 1/4 cubic centimeter tuberculin syringe and a 1/4 inch 27-gauge needle. If positive, rabies symptoms generally appear within 5 to 11 days. Rough hair, humpback, tremors, paralysis, prostration, then death. Examine the brain of each mouse for Negri bodies, using the same technique employed in the examination of the original brain specimen. Although you may be able to demonstrate Negri bodies as early as the 5th day after inoculation, they are usually more abundant after symptoms have developed. It is advisable to hold all injected mice for 21 to 30 days before making a final report on the specimens. Negri bodies, which may be found in the brain of an inoculated mouse, appear the same as those found in Negri-positive dog brains. The laboratory diagnosis of rabies is determined by the presence or absence of Negri bodies.